Hi guys, it's Dr. Ryan with another video review of one of the Step 1 Free 120 questions. In this video, we're going to take a look at Block 2, question number 27. So this question describes an 80-year-old woman who fell out of her wheelchair, and this is her second ED visit for a fall in the past 3 months. She lives with her son and daughter-in-law who say they do the best we can taking care of her. She has lots of medical problems. I give you lots of details in the question about this. She drinks whiskey each night. She's thin and disheveled, there's temporal wasting on exam, and she has scattered ecchymoses on her skin. And so based on this, what they want to know is which of the following is the most appropriate initial history to obtain from this patient. And they give you 5 answer choices, which you can read to yourselves. All right, guys, so this question is trying to paint a picture of a woman who's at risk for elder abuse. And they want you to recognize that and then realize that the most important thing to get more history on initially is her relationship with her family, to probe as to whether she may be in danger and you may need to take action to protect her from further harm. So how do I know this is a picture of potential elderly abuse? Well, first of all, it's an elderly woman who fell, and this is her second fall. So she's had a number of recent falls. Then they tell you that she lives with her son and daughter-in-law. And so because she's in a wheelchair and she lives with family, she's dependent on those people. So those are the kind of situations where elder abuse can happen when someone is elderly, their mobility is limited, and they're dependent on other people. They also tell you that she is thin and disheveled and has temporal wasting on exam. These are signs of possible malnutrition. So now you've got an elderly woman who's dependent on other people for a lot of her needs, and she has evidence of malnutrition. And then they also tell you that she has scattered ecchymoses, which suggests she may be having falls other than those falls that have brought her into the emergency department. So all of these things point to potential elder abuse. They want you to recognize that, and they want you to probe on her relationship with her family to see if you can uncover some evidence that she might reveal to you that she's in danger and needs help. As to the wrong answers, these are all completely reasonable things to ask about. Let's go through them one at a time. Abnormal bleeding is something to ask about because she has bruising, but that's not the best initial history. They want you to recognize that there's a risk of abuse here and go for answer C. Diet is important. She appears malnourished, so diet's something important to ask about, just not the most appropriate initial history to obtain. And then respiratory symptoms and urinary symptoms, these are of course reasonable things to ask about in an elderly person who's limited in having falls, but they're just not the best answer to this question. And that concludes our video review of Block 2, question 27.